Hi, good afternoon, everyone. Thanks for joining us today. As you know, this is a webinar about our newest member benefit, which is health insurance options through Bona Vita. We have Terry Gorman here with us today, and he's excited to answer a lot of your questions and give you information. I know here at the office, we often receive calls asking us if we have any solutions for the health insurance, with that the premiums and everything keep going up, and we know this is a big thing for your business. If you have any questions during the webinar, just type them in the question box and Terry can answer them at the end. And I just will remind you, this is not for CE credit. This is only for educational purposes and informational purposes, I should say. And this is being recorded, and we will have it available on our website if you have to jump off at any point. All right, at this time, I'd like to hand it over to Terry.
Thanks very much, Kelly. And thank you guys for joining us today, taking time out of your very busy schedules. It's much appreciated to listen to everybody's favorite topic, health insurance, or as I often refer to it, I often hear it referred to as a necessary evil. Certainly not something that a lot of people enjoy having to deal with, but we're here, and the New York State Funeral Directors Association approached us about putting together a program for them, which is something that we do at Bona Vita. It's one of our areas of expertise, is putting together association programs. New York State Funeral Directors is one of almost a dozen associations we have programs in place for, and it's an excellent program. But it's not going to be just about that program. As good as it is, we recognize that we don't live in a one-size-fits-all world, and for one reason or another, the New York State Funeral Directors Association health program might not be the right fit for everybody on this call. So I'm going to talk about the market in general, and then I'm going to talk about all the options that the small to mid-sized business owners have available in the healthcare space. And I will tell you that I believe that the New York State Funeral Directors Program is probably one of the best ones for you, assuming you qualify. We'll talk about everything that's out there. So with that, let's kind of start here. This is what we're going to do. We're going to talk about the state of the health insurance industry. Everybody knows it's the state of health insurance. It's not a pretty state right now. And we're going to talk about a little bit as to how we got there, what's been happening over the last number of years, and kind of based on everything that we're seeing out there, what we expect to happen over the next several. And then once we kind of get through all that, the what's happening, why it's happening, et cetera, then we're going to talk about all the options that are available to the small to mid-sized business owner. And then we're going to do a much deeper dive into the New York State Funeral Directors Association Health Benefit Program, which is a great and exclusive benefit for you guys. And we'll go through how the program looks, why it works, and then what's the process, if indeed it's something that you want to get into. So with that, inflation. We got a couple charts here, kind of talking about what's been happening with health insurance and hospital over the last number of years. And if you look at the chart here on the left, you go back and you look and you see that in 2014, Medicare, Medicaid, and private insurance were all reimbursing hospitals pretty close to the same amount for services. What you see now is a gap that is ever widening, where private insurance is reimbursing hospitals significantly more than Medicaid and Medicare are, and that is a gap that's expected to grow wider over time. I'm sure everybody's aware of the recent legislation that passed, and well, the administration swore up and down that Medicaid benefits would not be taken away. They are reducing, maybe not taking it away from people, but they're making it more difficult to qualify if you're between age 18 and 65 and you're generally healthy, et cetera, et cetera. So there is going to be lower reimbursements coming from the Medicaid side, and as the administration has also talked about capping RX drug costs for in the Medicare market, and all of that could be very good for the economy in general and for Medicare recipients. What it does is it puts an upward pressure on the hospitals to get more from the private insurance marketplace than they're getting now. So the expectation is, as much as we've seen this gap widening over the last 10 plus years, we will expect to see that that gap widening even further over the next 10. And then the chart on the right kind of tells a different picture. It compares the total healthcare spending to the total hospital spending over time. And if you look back in 1960, the gap wasn't too wide between total healthcare spending and hospital spending. In fact, what that means is that the vast majority of healthcare dollars were going to the hospitals. You see that gap also widening, and that's occurring for a variety of reasons. But one of the biggest ones is the cost of prescription drugs. Over the last number of years, we've seen the cost of prescription drugs rise dramatically, and as a result, we've also seen the impact of prescription drugs in the total healthcare spend. Back when I started in this market, not quite 100 years ago, RX benefits were taking up, I don't know, 10, 12, 15% of total healthcare spend. Today, we have clients where their RX costs are 30% of their total healthcare premiums. So the cost of drugs is getting to be a bigger and bigger impact on the overall cost of health insurance, and that's happening for a variety of reasons, some of which we'll get into as we go forward with this presentation. But these two trends are trends that we expect to continue. There doesn't seem to be any relief in sight for healthcare spend, and I don't know if we want legislation to deal with it, because the last time we had legislation dealing with it, the Affordable Care Act, all it did was significantly raise the cost of small group health insurance, which most of you are participating in, I believe, since that point in time. So not much relief in sight on that front. What else is driving costs? Well, there's a number of things that are driving costs. One of those are the renegotiations. And back pre-COVID, the BUCAs, and I'll refer to the BUCAs a couple times during the course of this presentation, and I recognize that we have a lot of jargon in the health insurance industry, so I'll try to keep it as simple as possible. BUCAs basically stand for Blue Cross, United Healthcare, Cigna, and Aetna. Those are the four major providers of health insurance in this country. Yes, there are others. Kaiser Permanente has some geographic areas where they're very strong, and there are other regional markets in the Midwest. There's Midwest Mutual, and there's other networks in different parts of the country. But for a national type networks, Blue Cross Blue Shield, United Healthcare, Cigna, and are the names that we're dealing with. And back before COVID, the carriers would negotiate with mostly hospital systems, but also doctors' offices, et cetera, for reimbursement for every type of procedure that you can imagine. And that's basically the way a preferred provider organization works, or otherwise known as a PPO. Every potential medical condition, every potential medical treatment, everything that's out there, every procedure imaginable has a pre-negotiated reimbursement level between the provider, hospital or doctor, and the network. Blue Cross Blue Shield, Cigna, United Healthcare, Aetna. Well, back before COVID, those insurance carriers and their providers would enter into anywhere between a 5 and a 7 year contract period for reimbursement. Well, they got into those contract periods, and then COVID hit, and hospitals saw some significant cost increases, and insurance carriers were picking up 100% of that type of stuff. So the the hospitals ended up not doing well. And so as a result, as they came out of COVID and some of these negotiations are starting to take place, they're looking to make up for dollars that they lost during COVID and in the immediate aftermath of COVID. And in fact, it wasn't that long ago where cancer patients at Memorial Sloan Kettering received notifications that Memorial Sloan Kettering and Blue Cross Blue Shield were in negotiations, and they were kind of at a standoff. And those patients were told, hey, if we're not able to come to a deal, we're not going to accept your Blue Cross Blue Shield. You're going to have to find your treatment somewhere else. Now, Memorial Sloan Kettering, as everybody on this call is probably aware, is the #1 treatment facility for cancer in the United States. So Blue Cross Blue Shield realized that there was an issue, and they more or less had to cave. And so their costs went up significantly, which means their members' costs went up significantly. And then we've seen that's the same thing with every other carrier out there. United Healthcare with Duke University, it's not on here, but here in New Jersey, Cigna and Atlantic Health Systems had a big issue for a while, but it's happening and it's going to continue to happen. And these negotiations are going to get more and more challenging. And then there's also in the small group market, the negotiations between the carriers and each of the state insurance commissions as to what they can do as far as raising their costs. So this is having an upward pressure on costs as well. And then finally, what else? Well, monopolies, lobbyists, and trials. So let's start with monopolies. And a couple things. Back pre the Affordable Care Act, 80% of physicians in our country were independent contractors. They were in their own practice or part of a small practice. 20% of physicians in our country were employees, generally of healthcare systems, but perhaps some private equity-backed larger doctor groups. Following the passage of the Affordable Care Act, those numbers have turned upside down. Now, only 20% of all physicians in our country are sole proprietors, private contractors, and 80% are employees, mostly of hospitals and healthcare systems. And in addition to that, whereas we used to have an enormous number of independent hospitals out there in the world, the healthcare networks have been gobbling up those independent hospitals. So here in New Jersey, for example, we have 3 major healthcare systems. There's a 4th down in South Jersey, a Pennsylvania-based, a Philadelphia-based network that has a couple of the South Jersey hospitals. But there are very, very few independent hospitals left. They've all become part of St. Barnabas, Robert Wood Johnson, or Atlantic Healthcare, or Hackensack Meridian. And as everybody knows, that the less competition you have, the higher costs you have. And so we're seeing that both with the hospital systems as well as the doctors as they become employees of private equity firms that are rolling up practices or healthcare systems. And that has had an upward pressure on costs. Lobbying. The pharmaceutical industry is far and away the largest spender of dollars in lobbying of any industry in our country. No one else comes close. The hospital industry is in the top 10. So while we often hear talk of legislation that is going to rein costs in, whether it be for drugs or this or that or the other thing, everybody knows, and we don't want to go down the rabbit hole of talking about politicians in this country, but everybody knows that politicians are not usually likely to push back against the lobbyists that are providing them with the funds that they need to get reelected on a year-over-year basis. And then finally, we go back to the RX again. We have a process where it takes on average 12 years for a new prescription, a new prescriptive drug to get through the FDA approval process. And then once it gets through that process, they have that in that company, whether it's Bristol Myers Squibb or Merck or any of them, they have in general a 20-year exclusive deal to be the only provider of that medicine. generics can't come into place until 20 years later in most circumstances. So we see that combined with the fact that there are more and more expensive drugs, and prescription drugs are becoming a bigger part of overall healthcare spend. That's where it's coming from. That's a big place of where it's coming from anyway. And when you see commercials on television about prescription drugs, every one of those prescription drugs are drugs that do not have a generic equivalent. And so that advertising is trying to push members, individuals, to go to their doctor and say, hey, I've been taking this other drug that's nice and cheap, it's generic and everything, it's doing a pretty good job with my blood pressure or my diabetes or this or that or the other thing. But I hear there's this other great drug that can do an even better job. And obviously some of those lobbying dollars make it to the doctor's offices as well. And then you see people getting moved off a drug that maybe is costing a plan $100 a month and getting moved on to a drug that's costing a plan $2,500 a month. So there's all these upward pressures on the cost of health benefits, and there is no end in sight from what we can see. Sorry for the bad news. And finally, as you, the employer, have to determine, do we want to offer health benefits? What, and I'm finding that most people in your industry are offering health benefits to their employees. It's the only way that you can attract and retain the talent that you need. Dollars alone are generally not going to do it. And what we've seen in this country over the last number of years is that insurance premium costs are rising at a greater percentage than wages are rising. So that puts pressure on you, the employer. It also puts pressure on you, on your employees, as to where their dollars are going to get spent. And we don't expect to see much change in that as we go forward. The impact of all this legislation on the economy could have a positive impact on wages in the near term, but there doesn't seem to be anything going on that will lessen the impact of premium increases. And just for further bad news, I'm eventually going to get to good news, guys, I promise. But just for further bad news, the impact this coming year could be pretty significant. We just got news last week that one of the major carriers in the individual and small group market in the state of New York has requested from the New York Insurance Department a 25% increase on their individual and small group rates for January 1. Now, I will tell you, New York's not going to give them 25%, but they're going to land in somewhere in the 12 to 15% range. And that is going to come right to you in your premiums. And so that is not anything that's going to get better in the typical marketplace anytime soon. And so then as you, the employer, are figuring out, well, what am I going to do? How do I control costs? How do I handle all this? What do I do? There is a huge mountain of information that you have to sift through in order to determine what's best for you and your organization. Kind of at the top of that mountain are the carriers, the networks that are available. There's your BUCAs, United Healthcare, Blue Cross Blue Shield, Cigna, and Aetna. Again, there are others, not many in the state of New York, but there are others. And then how do all these other pieces come into play? Underwriting. Yes, there, in the small group community rated marketplace in the state of New York, any fully insured program under 100 lives in the state of New York, there is no pre-existing condition. There are no health questions that can be asked in that traditional marketplace, but there is underwriting. What the carriers are doing is they're underwriting your geographic area. What's happening in the Bronx? What's happening in Queens or Brooklyn or upstate or Putnam County? What is going on and how is that impacting our costs? So they're underwriting geography rather than underwriting an individual group. Then as you are rolling out a program, how is that going to work with your payroll? You're going to have to get contributions from your employees. So how does all this integrate with your payroll? And who's going to handle the compliance? Yes, some of the reporting that has to be done from individuals as well as groups from the ACA standpoint has been lessened, but there's still a significant amount of reporting that has to be done out there. And how do you choose what's the right plan? Now, there's one carrier in the state of New York that has 48 different plan design options, with basically all having a similar deductible. How does a member determine what's the best option for them? And then cost is a big player. And then finally, is your broker a support tool, or are they just there to price a program for you on an annual basis and then move on and call you 10 months later when your renewal is coming? You know, there is and there are brokers out there that are very hands-on and very service-oriented, and then there are others that are just collecting paychecks. One of the things that I've always struggled with as a broker, as a consultant in this marketplace, is the way that brokers get paid. It never seemed to make sense to me that a broker should get a percentage of premium, because you know, we were just talking a second ago, or I was just talking a second ago, about how, you know, there's a carrier in the state of New York that's looking for 25% increase on their premiums, but you know, they're going to end up with 12 to 15%. That means that the brokers that sell their policies are going to get a 12 to 15% increase when your program renews. It just doesn't make sense to me. So there are some models and there are some brokers out there that have moved to a model where they're collecting a flat per employee per month fee. Their commissions or their compensation is not tied to a percentage of their clients' premium. And I think that is a much better model. And then, is your broker providing you with HR support? Are they giving you the tools that are needed to make the right choices? And are they helping you with the compliance, all the reporting that you have to handle? So these are all the questions that you need to ask as you're shopping for health insurance. And I always recommend to groups, hey, yeah, I think we're great and we do a phenomenal job, but you should go out and interview a couple brokers and find out who you feel best about and who's going to provide you with the services, et cetera, that you need. So it's a necessary evil. How do you handle it? What are the steps that we take to provide health benefits for our employees? Do we want to go full in, or do we want to stick a toe in the water? You know, sticking a toe in the water is kind of on the left-hand side, the go it alone. A couple of years ago, there was legislation passed allowing for individual consumer health reimbursement arrangements. But basically, what this is, you, the employer, provide your employees a set dollar amount on a monthly basis. It's a tax advantage for you. You get to write that off, and it comes to the employees in a pre-tax basis. And then they use it to go out and buy individual health coverage in the marketplace. And there's some compliance involved, making sure that it's being used properly, or they use it to reimburse for medical expenses if they don't go out and get the health insurance. But with the anticipation of federal subsidies coming up, rolling off the books here for the individual marketplace, and the fact that, you know, a couple $100 a month may not be sticky enough, a lot of employers decide that that is not enough to be able to maintain and grow their business the way they want. So they decide that they're going to procure a group plan. Now, in the state of New York, small group plans are considered any group that has fewer than 100 full-time equivalent employees. I would say that's the vast majority of organizations in your business, except for the large corporations, of course. So we're going to focus on the small group. In New York, if you're a small group, less than 100, your only option, as far as the state's concerned, is a community-rated small group plan, and that is basically the health of your population has nothing to do with your premiums. Your premiums are based on your geography. Period. End of story. And if I'm not mistaken, they composite rate the programs, which makes it very difficult for you, because your younger employees are going to end up being charged more than what they could possibly procure on their own. So they're not going to participate, and that may create some issues as far as meeting carrier participation requirements. In the state of New York, if you have less than 100 employees and you're on your own, you cannot level fund, you cannot self-insure. But you can look at an association plan. And the New York State Funeral Directors Association decided to offer a program this year that is being rolled out now, as you're all aware. It gives you access to getting outside of that community rated small group program. It gives you the opportunity to do that if it's the right fit for you and you're the right fit for it. And we're going to go through that in a second. Other option that you do have in the state of New York, if you don't want to go it alone in a small group community rated program, is a professional employer organization, PEO. And I'm sure that each and every one of you has been called by at least a half a dozen PEOs, probably within the last month. They're out there. There's hundreds of them out there. And they have very aggressive salespeople out there. And then there are very aggressive brokers out there that basically only do PEOs. And so they're calling you as well. And they can be a good fit for a lot of organizations. We have, I think, close to 50 clients that are in PEOs. And we did analysis for those clients to determine which PEO might be the best option for them. But they might not be the right fit for everybody. When you join a PEO, there's a new tax ID number that's issued. They do have to, they're required to take over your payroll. That's the only way they'll do business with you. In most cases, they also want to take over your workers' compensation as well as your liability. And in many of the cases, also all of your benefit programs, which will get you a discount on your benefits, but their fees are not always very, very transparent, and you may lose whatever discount you got on the cost of benefits with additional costs for compliance and HR support and payroll, et cetera, et cetera. So that is an option, and it's an option that works very well for a number of organizations, but again, it's not going to be an option for all. So with that, we'll do a little bit deeper of a dive into the association health plan. This is an exclusive program. You can only get into this program if you are a member of the Funeral Directors Association of New York. So that is a key. You guys, I'm assuming you're all members as you're on this call. We recognize this is not a one-size-fits-all world, so we have multiple designs. So there are a number of different design options. We're going to get deeper into each one of these, but I'm just kind of doing high level at this point in time. Fairly easy program to quote. There's one of two processes depending on how many employees you have on your current plan, if indeed you have a current plan. So we'll go through that as well. Minimal requirements. We do not have participation requirements with our program. So there are a number of carriers out there in the small group market that are going to require a 50% participation or 75% participation. You have 10 employees, you got to have at least 5 or 7 or 8 on the plan. We have groups that have 10 benefit eligible employees, but there's only 1 on the plan. So yes, we are a group plan, but we can go down to a group of 1. So that is an advantage that this program has. Up here, this is more of a generic presentation. Phil says we have savings of 10 to 15% on average. As we're talking to groups in your association, we're seeing savings closer to 30 to 35%. And then finally, with Bona Vita being the broker on this program, there's a significant amount of benefit and HR support that is available to you through the program as well. So let's do a little bit of a deeper how it works. There's kind of 3 major pieces to this program. Triad is the program manager. They have put this all together. They're based in Atlanta, Georgia. All they do are association programs, and this is the main program that they have. So yes, the New York State Funeral Directors Association is part of this program, but you're also part of an overarching group that includes the National Limousine Association, the Portable Sanitation Association, as well as many, many others. Bona Vita, we handle somewhere between 10 and 12 associations, but there's other brokers out there in the country. So this program that Triad has put together actually has tens of thousands of members in it. Triad has been doing this for well over 15 years. They worked with a number of third-party administrators over the years, and in the last couple of years came to the determination that the acuity group is the one that understands how this works best, because it's very different than a lot of other programs out there. And at this point in time, the vast majority of Triad's business is through the acuity group, third-party administrator. All of the New York State Funeral Directors programs, all of the members that are participating in this are going to be part of acuity. And that's a good thing. Acuity has a great number of tools and resources available to it. And we have found them to be the most, not only cost effective, but the most proactive third-party administrator that Triad's ever worked with. We have two different networks currently available, the Cigna network and the PHCS network. We're really, because New York is a unique marketplace, we're mostly focused on Cigna. PHCS is an option, but we're finding it's an option that doesn't necessarily work very well with some of the New York City-based hospitals. So we're kind of focused on the Cigna. We're hoping to have Blue Cross Blue Shield network on soon, but it's not there yet. TrueScripts is our pharmacy benefit manager. We talk about all the costs associated with prescription drugs. And there are a number of them. There are a lot of pharmacy benefit managers out there, and there are a lot of them that play funny games. We will only work with transparent fiduciary pharmacy benefit managers. These are organizations that are transparent in all of their pricing. They do not do any spread pricing, which is where they buy a drug for 60 cents and then sell it to the plan for $3. And they will also go overseas, or they will source drugs from other places if they can get them less expensively, which will positively impact plan costs. In addition to that, the program will handle all COBRA, if indeed you're required to provide COBRA to your employees, as well as a number of other services. And there are a lot of tools that are available to both the employer as well as the employees that participate in this program. Bona Vita is the program broker. We're the group that's here to help you determine whether or not this program is a good fit for your organization, getting you pricing if you wanted to find out how that works, helping your group enroll if you decide you want to move forward with the program, and then providing service not only to you, the business owner, but also to your members that are participating in the program going forward. You'll see pictures of the team that's focusing on that. And then, of course, none of this happens without the New York State Funeral Directors sponsoring this program. Very proactive on their part to move forward. They heard a number of their members asking for some solutions, and they went out and they found a very, very good one. So how does it work? Getting quoted, step number one. And there's two different avenues for that. If you have a current plan in place and you have 10 or more employees on that current plan, all we need to get you a quote is a very special census that is a detailed census, dependent level detailed census, and your current plan information. And with that, we can get you a quote thanks to AI. If you have fewer than 10 employees, or you don't have a current plan in place, or there's fewer than 10 on your current plan, there's another step. Yes, we need a census, not as detailed as what the one for 10 plus is. But then we also need each of your benefit eligible employees to click on a HIPAA certified secure link and take about 5 to 10 minutes to answer a personal health questionnaire. Personal health questionnaire, I equate it to if you go to the doctor and the receptionist hands you a clipboard with 3 or 4 pages stapled together and asks you to check the boxes of every condition you've dealt with in the last 5 years and provide some details on prescription drugs that you're taking. It's like that, but it's online, it's secure, and it's HIPAA certified. You don't get to see what your employees put on that form. New York State Funeral Directors Association does not get to see what your employees put on that form. It goes straight to the underwriters to help determine whether or not you qualify for the program, and if so, what rate tier you're going to be slotted into for this program. So let's talk about that. That's the underwriting process. So I will tell you right now, and we mentioned this, with the association when we were first talking about the program. Somewhere between 10 and 12% of the organizations that look into this program and may wish to participate will not be offered a quote. Let me explain to you why. You have a group of 7 employees, for example, and the dependent of one of those employees has hemophilia, or is in major organ transplant protocol, or is in stage 3 or 4 cancer and going through treatment. These conditions will cost the healthcare system somewhere between $500,000 and $1 million a year. If you have a major organ transplant, you are taking drugs that have a cost of between $500,000 and $1 million a year for the rest of your life. With 7 employees, we just can't collect enough premium to offset those costs, and they'd have a negative impact on all the other organizations that are participating. So there are groups that will want to get into this program, and I'm sorry for this, that will not be accepted into the program. But somewhere between 88 and 90% of the groups that want to get into this program will be accepted. And based on the overall look of the health of that group, they'll be slotted into one of 7 different rate tiers. Okay, rate tier number 1 is the one that is going to have the greatest savings, the lowest premium cost. If you have a population that is loaded up with a bunch of 27-year-old single men, you're going to be in rate tier 1, most likely, unless one of those men has a significant health condition. If you have a population that has people that are more my age, starting to deal with some of the health issues we deal with as we grow older, you might be in rate tier 4 or 5. You're going to see a lesser savings up front, but you're still probably going to see some savings, especially in the state of New York. So that is how the program works. 88 to 90% of the groups will be accepted, and then you'll be slotted into a rate tier, and that rate tier is going to determine whether your savings is 30, 35%, or whether it's only 10 to 12%. We get those results back. I'm saying 3 to 5 business days. Right now, we're actually getting small groups are being turned around in a couple of days. As we get closer to the 4th quarter, we'll get closer to that 3 to 5 days. If indeed this program ends up being the right program for you and your organization, and you want to move forward, we're going to present you with an overall analysis. We're going to compare it to what you're doing now, and you say, this is great, we want to move forward, then Bona Vita is going to help you move forward, get all the paperwork put together. If you need us to conduct employee meetings, we're going to do that, answer your folks' questions. We're going to be involved in the entire process, get you set up and on board, and then be there to service as we go forward. Potential savings, we'll focus in the New York City and New York area, 15 to 35%. Like I said, I've seen greater than that with some of the groups that we've quoted here in the New York State Funeral Directors. This thing was supposedly only live on June 1st, but we actually had people coming to us before that. And so we're seeing some pretty significant savings. And while that upfront savings is really, really nice, and I like it a lot, it's obviously, it's a great story to tell. What I think is the bigger deal is what happens at renewal time. Because to me, that's one of the biggest challenges that I think small business owners have, is as they're coming up to their renewal, and they're maybe also putting together their budget for what their costs are going to be next year, not knowing whether this is the year we're going to get the 7% increase or the 25% increase that some carriers are looking for. It makes it hard for you to price your services. With our program, because we have a wide spread of risk, tens of thousands of members, and we have the upfront underwriting process that I just talked about. What we're seeing are far flatter, far more predictable renewals than what you'll ever see in the more traditional marketplace. We have, and I've been working with the National Limousine Association for the last 5 years on a program that I put together when I was with a previous employer. That program initially rolled out in June of 2021, I believe. I'm not sure exactly when, but 4 or 5 years ago. So we just had somewhere around 25 groups renew on this past June 1st. The renewal increases range from anywhere between a -2.5%. Yes, you heard that right. We saw some of our groups see their rates go down to a +3.8%. That was the average. And that is not because, we're doing anything more special than spreading the risk out amongst tens of thousands of members, but the underwriting process up front, the management process up front. So while you can expect to see some pretty significant savings coming in, what you can also expect to see as we move forward is a far flatter, far more predictable renewal than what you're yet used to in the more traditional marketplace. Again, we recognize it's not a one-size-fits-all world. So we have 8 different plan design options available, ranging from rich, low out-of-pocket costs, low deductibles, low copays to see the doctor, low maximum out-of-pocket on an annual basis, most expensive, moving toward less expensive, higher out-of-pocket costs. All of our programs are national in nature, where I recognize you guys are all New York based, but what that means is if you have a child that goes to college out of state, you don't have to worry about whether or not this program is going to work for them in Illinois or Iowa or Utah. It works in all 50 states. So that's a positive. We also have 2 HSA options, high deductible health plans. HSAs came into being a number of years ago, and basically the way an HSA works differently than a more traditional preferred provider organization type plan where you have deductibles and copays. With an HSA, you have to meet your full deductible before the insurance starts kicking in and paying anything. It's a way to reduce premium cost and can be a great tool. But I only recommend HSAs to organizations that also set up and encourage their employees to participate and actually put dollars into a health savings account. So if they need the program, they need benefits at some point in the future, the dollars are there to cover that deductible that has to be met before the insurance is going to kick in. So all of these are available, and you don't have to choose just one. You as the employer can make any one or all of them available. As I don't recommend that you offer 8 different plan design options to your staff of 10, but you can have different options available, and we'll work with you individually to determine what is the best one or ones to offer for your particular population. A couple things that are very, very important with our program: we do not have participation requirements. So whereas in the traditional marketplace, and I said I hate to repeat myself, but it's an important note, is that most of the traditional carriers are going to have participation requirements. Yes, we'll underwrite your group, but only if 75% participate in the program. We have groups that only have 1 employee participating, so there are no participation requirements. We do handle COBRA for groups that are COBRA eligible. We do all of that, so we have a lot of flexibility with our program that you might not typically see in the more traditional marketplace. Sorry for the pictures, but this is the group. Phil Shetson is the founder and president of Bona Vita. He's in his mid-30s, and he's trying to build something pretty impressive here and has no plans to sell or merge with anybody. So this plan and no plans to work into the large group space. We don't have any clients that have 1,000 employees. Our niche is the small and mid-market, and that's why this program is a great fit for Bona Vita. This is all I do. That's me there. I'm the senior member of this team, that's age only. But all I do is the association program. I manage, like I said, somewhere between 10 and 12 of these programs. Some of them more active than others. And Millie and Amy are my support for the program. They do a couple of things, but the vast majority of their time is spent on this program. I mentioned that, hey, a PEO might be a right fit for you. We do PEO analysis. We look at the more traditional marketplace for groups that can't qualify for a program like this. We also do dental and vision and life and disability and all of that. And Phil is a certified financial planner and is very, very good at putting together 401ks and those types of programs for our clients, if that is something that is desired at some point in time. But our important focus is on the small and mid-market, the underrepresented marketplace. All the brokers out there want the large clients. Less work, more dollars. But we know we can't compete with the Mercers and the Towers and the Watson Wyatts of the world. We have our niche. We like to provide large company benefits and large company style service to the small and mid market. That is what we do. If indeed your group decides to move forward and you want to enter this program, every member that signs up is going to have access to a dashboard, both through their computer as well as onto their smartphone, where they can find providers, check to see how they're doing with their deductible, see whether getting their blood work done at a standalone lab or in a hospital setting is going to be more cost advantageous for themselves, for their HSA plan, whatever it may be. These are all tools that are available to them both on a computer as well as on the smartphone. In addition, the administrator of the program, whoever the owner or the designated representative for the owner of that business is, has access to an employer admin portal where they can put information in for new hires. They can go in and indicate that an employee is retiring at the end of August and they need to go on COBRA as of September 1st. They can check what's going on with claims, what's going on with their bills, et cetera, et cetera. So all of these are tools that are available to you. And then you have myself, Millie, Amy, and even Phil, if needed, if there are issues that can't be handled through the tools that are made available to you. What's the member experience like? Same as it is right now with your insurance carrier. One of your employees gets sick, they go see a doctor. The doctor sends an invoice to Acuity. They're not sending it to Cigna or PHCS. They're sending it to Acuity. But Acuity, who is working with, has access to the Cigna network, goes in to see, doctor provides a $400 bill, but they go in and see that Cigna has negotiated $180 for reimbursement for that particular procedure. They see where that individual is with their deductible or copays, coinsurance, et cetera, and they reimburse the provider as per the contract, and then they send an explanation of benefits to the member so that they can see, okay, I went for this procedure. The doctor wanted to charge $3,000, but the insurance carrier was able to negotiate that down, or they negotiated it down to $1,000. My responsibility for that was 20% because I haven't met my deductible yet. So they paid the provider $800 and I'm responsible for $200. That's how it works, kind of same as it probably does right now. And then, you know, there's more information here, but get quoted. This has a lot of information on the program. Here, we've set up a website. There's a link to this from the New York State Funeral website, I believe. And then there's also a way for you, if you want information on the program and you want to speak to me or somebody on the team directly about how this might work for your particular funeral home, you can complete this. It goes right to me, and once somebody reaches out to you. In addition to that, we have frequently asked questions. We have the plan designs we just went through so that you can see that. Here's the census format that we need for groups that have 10 or more employees. And then there's provider search tools as well. So there's a lot of information here that's available to you on this program. And then with that, I'd like to say thank you and then open it up for questions, comments, etc. Kelly, I'm not seeing a Q&A thing, so if you're seeing stuff there and you want to shout them out to me or tell me where to go, and I can see them and answer them myself.
Yeah, sure. So as the host, I'm the only one that can see them, unfortunately, okay. But I will read them off, and if anyone has any questions, you can type them in the box. And as always, you can reach out to Terry at any point. So is there an age of an employee that would disqualify a funeral home from being eligible for the coverage?
No, but our program cannot act as a Medicare supplement program. So if you have people that are over the age of 65 and you're a small group, they really shouldn't be on your group health insurance anyway. It's to their advantage as well as your own for them to be on Medicare and get Medicare supplement coverage. So that is the only age challenge that we may have.
Okay. So currently there are no other questions. That was the only one we received. So like I said, Terry, thank you so much for this important information. And do you have your information you could put up on the screen in case anyone wants to reach out?
Let's see here. I think, Kelly, I'm so technologically challenged. I don't know how to do that, but certainly we can maybe you can send an email out to everybody at the end of this. I think you were recording this, and maybe you can send an email out to everybody that's got the recording and include my information there. But I'll for anybody that's got a pen handy, I'll give you my phone number right now. It's my cell phone, so you can text me here or call me. Just please identify yourself so I know who I'm talking to when you reach out via text. But my phone number is 646-438-4959. That is my cell phone. I do put it on Do Not Disturb when I go to sleep, but otherwise it's on 24/7. So please feel free to reach out or send me an email.
Perfect. Well, at this time, thanks everyone for joining us, and thank you, Terry, and we hope everyone has a good rest of your afternoon.
Thanks, everybody. Thank you, Kelly. Bye-bye.